at the University of Ottawa. He joins us this morning to discuss the latest on COVID-19. Good morning, Doctor.
Good morning.
And thanks so much for joining me today. I just wanted to ask you some issues with AstraZeneca's vaccines to start were raised this week, causing a little bit of concern. There were reports of blood clots, I believe, in at least Denmark, where they've suspended the use of that vaccine for now. I guess what message would you have for Ontarians who have concerns about the AstraZeneca vaccine?
Yes, this is the most scrutinized vaccine rollout in history, and so anytime there's anything slightest bit wrong, it gets amplified by the media. We have to remember that the vaccine is being given largely to elderly and infirm people right now. And guess what happens to elderly and infirm people? They have problematic medical outcomes often. Often that's not related to the vaccine, it's coincidental. So anytime you hear these news reports, you have to ask yourself, is this correlation or is it causation? There has been some investigation now, and it does not seem to be causation. The vaccines are not causing the clots. Even if they were, look at the numbers. We have 30 clots out of 5 million AstraZeneca shots in Europe. That's 0.0006% of cases. And the actual risk of serious clotting in the general population is like 0.02 or 0.07%. So the vaccine group has a lesser incidence of clotting than the non-vaccine group. Therefore, this is not anything to worry about. Also remember that we get our vaccines, the AstraZeneca shot, from India, not from Europe. It's a different batch entirely. Bottom line, this is not anything we should worry about.
I'm sure listeners will take at least some comfort in hearing that as well. Now, people maybe not know that there are some side effects to these vaccines, I guess, that we have heard about, just in terms of minor ones. So, do you tell people, I guess, what do you tell people who think that as soon as they see any kind of adverse reaction or side effect from a vaccine, that it means it's bad?
We have to be honest and say this is an alien thing being put into your body. An alien meaning it's not from your body. So there are going to be some slight risks. Nothing is without risk. In general, the risks are you're going to have some pain, some fatigue, maybe a fever lasting 1 or 2 days at the most. You got to balance that against what you're trying to prevent here. What you're trying to prevent is infection from a potentially fatal disease, COVID-19. So the risks, while not zero, are so small that they pale in comparison to the potential benefits, which are a normal society and immunity from a potentially fatal disease.
Yeah, fairly clear on that one for sure. Just given right now, we're ramping up our vaccine rollout. We have seen a slight increase in cases over the last little bit, but we also see the variants kind of spreading across the province as well. So it's this weird kind of confusing time where people are kind of, seeing vaccines and being optimistic about vaccines, but we still have the pandemic and the cases and the variants still going in the background. I guess what should we be concerned about? What should our focus be on when we see case numbers and vaccine numbers and things like that? What should we be focusing on for a sign of moving forward?
It's a good question because we've been accused, we meaning public health, epidemiologists, etc., over the past year of being fear mongers and never telling good news. And when we start telling good news, we're accused of not being dire enough given the circumstances. So there are two narratives happening simultaneously. One is the end is near. We're in the final legs of this thing, lasting a few more months really. And the other narrative is that right now is a dangerous time. And both are true. Both are true simultaneously. I've been likening this to being in the third act of a movie, and in the third act you fight the biggest foe. And sometimes it's the biggest foe not because it's the scariest foe, but because the hero is the most tired and least prepared. And this is where we are. We are the hero. And the new variants are a real threat. It looks like they are going to achieve dominance, in particular B117, the UK variant, achieve dominance sometime within the next couple of months, given current trend lines. When that happens, our hospital system will be overwhelmed, more so than it was during the peaks of COVID Classic, as I call it. So that's the threat. The good news is, of course, the vaccines work, and we have them. We just have to get them out as quickly as we can. So I want to tell people that we're looking forward to a normalish looking summer. And after May, I don't anticipate any more economic restrictions happening ever again, because vaccinations will be well along their way to sufficient deployment. But to get there, we got to tighten our belts a bit and hold tight, because the numbers are climbing, and it looks like this is the beginning of the fabled third wave.
And so you do anticipate by around May that we should be able to lift most of our restrictions here in the province?
I don't know about most, but around May we'll be starting to lift some things, and we will not be putting them back into place.
Gotcha,
So
gotcha.
some mitigation tools will remain in place for several months, but day by day, things will get normaler until finally they're fully normal.
And that's obviously optimistic news to hear. We saw U.S. President Joe Biden say this week that they'd be ordering states to make all adults eligible for a vaccine by May. Do you anticipate Canada following along, not the exact same timeline, but a similar timeline in terms of when the general public will be able to get a vaccine?
That's the plan. So the federal government has announced they expect every Canadian to have access to at least one dose by July. I'm assuming that's the end of July. And the Biden administration has said they want to have population immunity by July 4th or something like that. So it's kind of in the same timeline. I'm a little more skeptical. I think we will probably have access to doses for everyone by the end of the summer. But that's good enough. I mean, we'll be starting to, again, taste that normal early in the summer and have more things open by the end of the summer. Maybe this will all be some fever nightmare by then, some dream that we didn't that we doubt ever existed. But remember, the Americans are well ahead of us. They have more doses, they have more money, and they have a head start.
And that's what I was going to ask you in terms of the rollout here. We have seen it speed up exponentially in terms of what we were doing just a few weeks ago. But in terms of the current vaccine rollout, do we have enough doses? Do we have enough, I guess, capacity to give them out? I guess, what grade would you give the rollout here in Ontario and in Canada right now?
It's a good question. We've always struggled with sufficient doses, and we're still struggling with getting sufficient doses. And we've also been struggling with the rollout. I'm sympathetic to the rollout hiccups. You're gonna make some mistakes early in the game. I think we've made sufficient mistakes now that we should be getting things a little more streamlined. I'm hearing really good things about the Ottawa experience of getting it into the elderly in these open vaccination clinics. And Toronto is doing it from a hospital basis. Early on in December, January is a little ugly, but I think it's much better now. So if we can get sufficient supply quickly, I think we have the capacity and the infrastructure to get the doses into arms, especially now that we have the new doses of Johnson & Johnson and AstraZeneca. These are really good for pharmacies and for family doctors to be giving. So we don't need to rely upon the complicated mobile clinics or having things run out of hospitals. We can have these big vaccination clinics that we're used to for the flu work the same way for the COVID vaccine. So there are going to be some hiccups, obviously. And as an epidemiologist, my concern is always for the data flow and the data integrity. Are we collecting the data well? Are people being communicated well via our online systems? I've seen some good systems and some bad systems, and I think we are learning from the best systems and improving the ones that we currently have.
And the Ontario government set to roll out its online portal. I'm assuming, now we can't know for sure, but I'm assuming that's what's going to be announced later on this morning. Doug Ford has scheduled a news conference for 10:30. That portal was supposed to be up and running by tomorrow. Just in terms of the province's rollout here, they've added pharmacies for a pilot project. Family doctors are now administering the vaccine. How much do these moves kind of speed up all of the rollout in the province?
The pharmacies are huge, huge. Think about how most of the people you know got their flu shots. They didn't get it from the doctor's offices. They didn't get it from a mass vaccine campaign, probably organized by the city, many did. Most people get it from the drugstores now. And when we started giving flu shots via drugstores, uptake was much faster and much higher and much more convenient. And this is going to matter a lot. And pharmacists are just itching to be able to do this. So I think the pilot project is going well. There's some confusion. The online booking system is not as good, and people are calling in drugstores, and that's overwhelming the system. But it will get better. So the way it's done around the world is kind of similar to this. India has a remarkable deployment process with great data infrastructure, QR codes, using your cell phone to keep track of who got the shots, etc. The UK had a similar system using their healthcare system, not just pharmacies, etc. And the US is doing a more private sector-based approach in some states, relying upon private sector drugstores like CVS to take the lead on this. It looks like it's getting seamless. So long as the booking process is easy to understand. I'll give an example of what I mean by the booking process being important. I'm impressed by Michael Garron Hospital in Toronto. Their online booking process asks important questions, especially for seniors, like, do you need someone else to make the appointment for you, like a child, an adult child? Do you need help getting to the injection site? These are important questions for the immunocompromised, the disabled, the elderly, that often don't get covered in a standard booking portal. So the fact that some people have taken the time to consider these issues fills me with confidence that the overall system will be good.
And obviously, everybody's going to try to improve as the rollout continues to go. Just in terms of the current state, I was just thinking about St. Patrick's Day coming up this week. We have been talking a little bit about later on in the spring. More acutely, though, closer to right now, we have St. Patrick's Day coming up. We have April break, kind of a delayed March break coming up. Are you concerned at all that we could see a similar spike to what we saw over the course of the Christmas break during some of these holidays?
Yeah, totally concerned. Now, I don't think it'll be quite as bad as Christmas, because Christmas is the biggest time to socialize, but it will be something resembling a spike. The big unknown, of course, is have we vaccinated enough of the elderly to prevent the death toll arising from that spike? I don't know. Right? I think, even though I said we're looking at the beginning of a third wave, I don't think the death toll will be quite as high because we did a good job of vaccinating a long-term care residents. The unknown is, have we done a sufficient job in getting into our community-dwelling elderly and others? So infection is now shifting from the older demographic to the younger demographic, and that's what will be reflected in the hospitalization rates, but hopefully not in the serious COVID rates. So yes, I am concerned, but I'm not concerned, right? I'm concerned the numbers will go up. At the same time, I have some strange optimism that the suffering might not be as bad.
Well, and the province did declare victory this week in terms of, vaccinating long-term care homes. They've called the rollout a success, as most people have got vaccination. I guess that would bode well in terms of just more serious symptoms moving forward, as you mentioned, just fewer deaths perhaps in the third wave.
Oh, absolutely. I think that's going to be the case. And the question is, how much fewer? It might not be a huge dent, but I think it's going to be significant. That's not to say, though, that we should celebrate these infections. Long COVID is a thing. You don't want to get this disease. We don't know what the long-term morbidity issues are going to be. So as the cases spike, and hopefully deaths don't spike, that's still not a moment to say, hey, everything's fine. Everything's not fine. And the hospitals can still get overwhelmed because we've plateaued at a high level. Like here in Ottawa, 100% of our acute beds are still filled. So there isn't a lot of space here to absorb any additional cases, even cases that do not lead to mortality.
Yeah, and you could argue that we luckily stayed in orange this week. We could have pushed to red. We've seen when we have lifted restrictions in the past that we do tend to get more infections, obviously, with more people out and about and things like that. But is there a concern that now with the optimism surrounding vaccines that people are completely tuning the message out in terms of, possibly preemptively thinking that the pandemic is over?
I think that's a real concern, especially when we're watching American TV. And the Americans are doing fairly well in getting their vaccine out. And you see American late night talk shows where the guests are now in the studio. There are some audience members present. There are people out and about in society. The CDC has issued guidelines that if you've been vaccinated, you can actually socialize together without masks. And a lot of people have been vaccinated, so we're hearing reports of mass socialization. We can be seduced by watching the media of other countries and think that's us. That's not us yet. It will be us soon. It's not us yet. So I'm quite concerned that message is not being stressed and percolated sufficiently.
And just in terms of last one for you, this summer, a lot of people booking, camping trips, things like that, looking ahead to the summer months. You mentioned, hopefully the plan is for all of us to be vaccinated. For people looking to get out this summer, I guess, what's the message for them as they look to book these trips in terms of keeping themselves and the community safe?
Camping trips sound great, especially if you're sticking with your family and people that you know well in your bubble. Outdoor activities sound fantastic, as long as it's not in large groups. Booking trips to places on planes, I think international travel is going to be questionable for some time, given the fact that the distribution and deployment of vaccine around the world is heterogeneous at best, and the different types of vaccines being used are quite different. Domestic travel, a bit more confident there. But different provinces will have different states as well. But I think by the end of the summer, we can be fairly good and confident around our domestic vacationing. Definitely camping trips. Large concerts, nope, I don't see that happening for some time. Large sporting events, I don't see that happening for some time. But some other factors, absolutely. I think we can look forward to having a good time this summer to a large extent.
Yeah, and those tiny steps are still valuable at this point. Dr. Raywat Deonandan, thanks so much for your time this morning. I really appreciate it.
Thank you.
It's